Hello and good afternoon, everyone. Welcome to the 10th episode of PsyTalks with Psychologists. And I'm your host, Ms. Basha, Director at IJA's Institute of Clinical Hypnosis and Related Sciences. Today we have with us Dr. Avinash D'Souza. He will talk about innovative aspects of autism spectrum disorder. And before we begin, whoever is watching us, you can feel free to ask any questions that you have in the comment section and we'll surely answer them. You can also start a watch party on the Facebook so that your friends and family can benefit out of it. ICHAS focuses on helping psychologists, coaches, trainers develop advanced coaching and therapeutic skills. So today we have Dr. Avinash, and a brief introduction about him. He's a consulting psychiatrist and a psychotherapist, a consultant at a school, has a consulting room from where he operates is at Santa Cruz West in Mumbai. He's a research associate at Department of Psychiatry, Lokmanya Tilak Hospital, as well as college in Mumbai. And he comes with around 20 plus years of experience. He's also a founder trustee at D'Souza Foundation, organization that mentored all sectors. So, welcome, Dr. Avinash.
Thank you.
So, Dr. Avinash, a brief introduction from your end, and then we can start with our topic for the
day. As she has introduced me, I am a psychiatrist, but autism and developmental disabilities is a topic which is always close to my heart because when I started my work in psychiatry in 2001, 2002, when I used to visit around 10 different special schools in Bombay as a psychiatrist, and that's where I learned a lot about these children. I still work with Dilkush School and the Kalyandeep School at Vile Parle and with many inclusive schools where we help these children. So my understanding has been more hands-on than theoretical. And so I hope to probably learn and educate you all both on certain innovations in autism.
Lovely. Dr. Avinash, if you could just define autistic spectrum disorder for us.
Well, autism spectrum disorder is a disorder which is characterized by three main features. One is the child or adolescent with autism spectrum disorders prefers to be socially isolated. Their social skills are limited. They can be trained, but they prefer to be aloof. They prefer to be not mingling with people. They have poor eye contact. They appear to be lost in their own world. So that's the way they appear. They also may have developmental delays. Some of them may have exceptionally higher IQs. Some of them may have IQs in the normal range. Some may have extraordinary skills in certain areas. And most importantly, children with the autism spectrum disorder are born usually normal. They have normal milestones. And it's only after the age of 1 or 1.5 or 2 that this development, which is pervasive, starts, and they lose acquired skills and they may lose speech at times or lose other skills. And that's when the parents realize something is wrong. And when they visit a pediatrician or a psychiatrist or a pediatric neurologist, they are then diagnosed as having autism.
So it is something that can we say that it is starting at birth or it starts before birth? These kind
of there are multiple causative theories which have been proposed for autism. So it's very difficult to predict when does the process actually start. So there is a genetic basis that is not yet proven but is being tested. So it definitely starts before birth. Then there is also certain theories that talk about certain maternal infections in the mother that may be a causative factor. Certain vaccinations have been implicated, though nothing has been proven as yet, and that theory has also been proven false recently. Yet people still link the MMR vaccine to autism, though it's not proven. There are other theories wherein chemical imbalances in the brain have been implicated. There have been other theories where genes on certain chromosomes have been implicated. And many of them say that we don't know the cause of autism. There's a hormonal basis which has been implicated. So it starts in the developmental period, no doubt, but manifestations of autism are usually seen post 1.5 year of age. So the first 1 year is smooth sailing, and then after that you see problems that happen. And that is why in the earlier classifications, autism spectrum disorders were grouped under what was called pervasive developmental disorders, for the very simple reason that development would be normal and then pervasive. So that is why the term PDD or pervasive developmental disorders was there. But now, of course, it has all been unified into one large conglomerate of what we refer to as the autism spectrum disorders.
I think that really clears the term autism spectrum disorder. So we said that it has certain hormonal imbalances with the child is it's he or she. So is it with the mother's hormonal is imbalance?
Well, see, there's nothing really proven here. I mean, in my practical clinical experience with developmental disabilities, whenever a child with developmental disabilities is born, both parents always have this tussle कि मदर के साइड से हुआ है या फादर के साइड से हुआ है, because who do you put the blame on for the child being born that way? So that tussle is always there. But I think in autism what happens is they rather say that it's seen due to general hormonal imbalances that you see. So it's not something that is paternal or maternal, it's in the child while the child develops. So one of the theories which they have put forward is that when a child is in the mother's womb at the period of 7 months or 7.5 months, depending on the child's chromosome. So if he's a lady, it's a girl, it's an XX chromosome. If it is a man or a boy, it's an XY chromosome. So at 7.5 months, the child is bathed in estrogen or progesterone, which are the female hormones. If they have if it's a girl child, and if it is a boy child, it is bathed in testosterone, and that is what leads to the genital development and the development of the testes, the ovaries, and multiple other things. What has been seen in both sexes in autism is that at this phase, testosterone, the male hormone levels, are far higher than they usually would be. And testosterone is a hormone which is known to cause aggressiveness and social aloofness. So if you see young teenage boys, they begin to talk less, they begin to remain aloof, they prefer to not talk to their parents. So that is because of the testosterone surge that you see in them. So this extreme male brain theory is one of the new theories for autism, and it's been there for some time, and it has been proposed by Dr. Simon Baron-Cohen from the UK. And so he came up with this theory, and that's why they say that there's a probable hormonal basis to autism. Though this is not related to the paternal side or the maternal side, so we really can't say there. But though I will also mention here that the only one thing which we do know is that autism spectrum disorders are far more common in boys and male children compared to girls.
Okay, Doctor. In fact, my second question was about what is new with regard to autism spectrum disorder. So you already proposed one of the things you already told us. If there is anything else that you can share with us with respect to
Well, I think there are a number of new things which have come up in the recent years. I mean, therapy-wise, there are a number of new treatments that are being tried. So, I mean, I will just give you an overview here, and then we can go to the individual treatments as we would wish. So, on the medical side, there are hormones which are being investigated as a treatment. So, there is something called oxytocin. Oxytocin is supposed to be your romantic hormone or your love hormone, and you tend to sort of uh, uh, mix socially more if you have higher levels of oxytocin. So what usually happens is that if I have high oxytocin levels, I feel nice, I mingle with people. So intranasal administration of oxytocin and medical use of oxytocin is being tried for autism, though we've not yet found success as a cure. There was always a theory that autism was caused by gastrointestinal malfunction. And keeping that in mind, gastrointestinal hormones like secretin and cholecystokinin were implicated. And now people are looking at trying secretin as a therapy for autism, and that's also being tried. Because of this, a number of probiotic preparations. Probiotics are basically bacteria which are normal bacteria in our body, and they are available in tablets and capsule form. So they are also being tried. So that's the medical side. From a therapeutic side, I think uh, there have been some proponents and some dissonants of stem cell therapy, though frankly, we haven't seen success with stem cell therapy in autism, though that's one of the new therapies that is being tried. It's in research mode. Nothing has been proven as of now. We also see within occupational therapy certain modifications to aqua therapy, certain modifications to animal assisted therapy, certain modifications to bright light therapy, which is being tried in autism. They say even getting an autistic child a pet is very helpful, and certain new dimensions of pet therapy have opened up in autism spectrum disorders. And I think most importantly, the dietary therapies haven't really held their fort. So we've not really had new dietary therapies which have come in. But the whole new emerging field, which is very important, is a field that I have labeled as psychoneurorobotics. That is the use of robotics in
Yes.
psychiatric and neurological disorders or neuropsychiatric disorders. So we've used it with older people who have dementia very successfully. We are using it with children who have autism spectrum disorders successfully, and slowly it will come into other fields as well.
Lovely. I think we are quite updated with what is happening currently in this issue or in disorder. Doctor, we'll just have a quick greeting, say hi to everybody who's there online. Hello, everyone, and welcome to the PsyTalks with Psychologists. We have Dr. D'Souza with us today. So, hi, Rashmi, and I think there are questions that are there. I am going to ask those questions. So, Dr. D'Souza, Rashmi's asked that at what age can one diagnose ASD, and what could be the
Well,
symptoms for it?
okay. Autism can be diagnosed as early as 1.5 2 if you're very vigilant. One thing what we always advise parents is the moment we see autistic features, let us start intervention because early intervention is vital. While let us not look at a confirmed diagnosis as yet, let's look at symptoms and start intervention. You can always have a confirmed diagnostics with tests, etc., which can be done post 2.5 3. So that is what I would suggest. The early symptoms which they want to know could primarily be uh, social aloofness. So even as a baby or even as a toddler, the child wouldn't want to mix with other children. The child would prefer to remain in his own world. Eye contact would be poor when he's called. Responsiveness to his name would be poor when he's called. Even if the mother or the father tries to play with him, hug him, and normally toddlers would love to engage in plays which involve physical closeness. This child wouldn't be very interested in that kind of play. And speech development wouldn't be on par with other children. So it could either be normal or it would be underdeveloped or not developed at all. So these are early pointers towards the autism spectrum disorders.
Um, I think there's one more question. My audio has a problem. Okay. Dr. D'Souza, can you hear me clearly?
Yes, yes, I can.
Okay. I think the audience has told us, especially my voice is not clear. So I will try to use this a little like that. The next question that I would like to ask you is what are the innovative methods of treatment for ASD?
Well, I think, see, one of the things which I think the most important innovative method that I would want to talk about is two: the use of animals, and third is robotics. Because what happens is children with autism spectrum disorders take to robos for primarily three or four reasons. One is they are not threatened by a human figure, which they find threatening very often, and they prefer to be socially aloof. They also find the robo very friendly and uh, I would say a little monotonous, and that voice is what they like more than change of tone and voice as human beings would have. So they get attracted more to the robo. They also love to interact where they know they are in control of social communication. When you interact with a fellow human being, you may not always be in control of the social communication, but when you interact with a robo, you can control the communication the way you want, and they can always put off the robo. So that's one thing which they have in their hands if they feel uncomfortable. So they prefer that. And you have robots of different levels. So you have robots that primarily can serve as a sensory means. You have robots that can improve speech. You have robots that can improve social communication and you can have robots that teach manners. You can have robots that primarily teach the child basics, teach the child academics, and you can have a robot just as a companion, as a friend. So there are multiple areas in which these robots can be used. So that's one aspect. The second aspect is animal assisted therapy, which has made leaps and bounds as far as autism spectrum goes. And we're seeing the use of dogs, the use of cats, the use of birds in children with autism spectrum disorder. Unlike abroad, and with I think our strong animal laws, we are not able to use horses, or we are not able to use, and we don't really have the space for dolphin aquariums like people have abroad. So I remember on my visit to Dubai, I happened to visit the Dubai Autism Center, and they use animal assisted therapy, and they're using dolphins in the treatment of autism spectrum disorder, and the children just love sitting on the dolphin, playing with the dolphin. I mean, that is something which probably we need someone who can invest a lot and bring here, but it'll probably, the climate is different, you need a lot of specifications for that, so it's a little tough. So this animal assisted therapy is there. Equine therapy, or using horses for children with autism, is something that is done in countries where colder climates and horses are easily available therapeutically. So there also, this is something which is being tried. So these are I would say the main two innovations which have come up.
Mhm. Lovely. I'll just check if we have some questions from our audience. So Bhakti has asked Dr. D'Souza, how do you deal with ADHD with ASD children?
Okay, the answer here is that ADHD exists in two ways when it comes to autism spectrum disorder. A, it could be a part of the symptoms of autism itself. B, it could also exist as an independent entity. So the most important facet here is we try and dissect out whether this is just mild ADHD, which is a part of the ASD or the autism spectrum. So then it's dealt with through therapies and other means. But if we find no, we're really seeing a huge ADHD component here that warrants a diagnosis clinically of ADHD plus autism spectrum disorders, then you need to treat the ADHD like you would do normally. So that would include remedial education, occupational therapy, some kind of physiotherapy if needed. And I would say definitely around 50 to 60% of children would need medical help also, because unlike with the children going to a mainstream school, children with autism spectrum disorders may not really be very amenable to behavior therapy at once. So you may need little medication to calm them down, make them sit down, so that they benefit even from their remedial and occupational therapy sessions. And one thing which I just want to say for the benefit and knowledge of all therapists here and psychologists here and viewers is that there's always this myth that when we're going to give a child medication for ADHD, we're going to dull him and make him quiet and just dose and sedate him. So please be rest assured that we have very good medication in 2020 for ADHD, time-tested medications which have been used over the past 10 years. And we don't have children who just are put to sleep and we tell you that we're controlling the hyperactivity. No, that doesn't happen.
Lovely. Fantastic. Neha has asked, is there any specific name or source for robo for speech development? I think she's a practitioner.
Okay, there are multiple robots which are available. So you need to go to a shop that has robots, check them out, because the robots aren't designed for autism spectrum. You have to use them. So you can go check them out, but you have to have the brain and the acumen to use them, for your children. So if you know autistic children well, when you see a robo, you'll know, yes, this is the one which is going to work for me. So just buying a robo won't help. So you also need to know how to use that robo well, what you need to teach the robo, what you don't need to teach the robo. So there are multiple things that will come into play. So I think there are all sorts of robos available. It depends on what you would prefer to use.
I think that helps, Neha. Trupti has asked about any home activities that you can suggest for ADHD and autistic children. Or I
See,
should copy that.
there are multiple home activities that can be suggested. Now, they would include uh, kneading of dough in a kitchen, playing with rice, sorting out grains, sorting out different types of dals. They would also include, running up and down the stairs if you have, particularly in the lockdown when the child can't go out. So these are things that can be done indoor. A number of games can be created where you have a waste paper basket placed at one end and the child tries to throw a ping pong ball into that, or tries to throw any other ball into that. So that is there. Indoor basketball can sort of be made uh, for smaller children, of course. And you can also have a game where a child has to twist and turn himself on a piece of paper, and you keep folding the paper till he so his energies sort of go there. Apart from that, you may also engage the child using various apps that help to increase focus and attention. These are all available free. You have to just search for them and download them on Android or iOS, and you can use that. You also have multiple things the child can be shown online. Now, I'm not asking you to keep him online the whole day, but there are a number of museums, a number of national parks, a number of National Geographic shows which are available, and the child can learn a lot seeing these shows. So this is something that you could use. You'll have to sit with the child and explain to him while he's seeing all this. You can't leave him alone. So that is something which you may have to also work on. Finger painting, hand painting, rangoli making, multiple things which can be done.
Um, so some activities, I think Ashwin has already answered that question. She's asked about how to reduce temper tantrums and aggressive behavior in such kids.
Okay, one of the important facets is that whenever children show temper tantrums in general and children with the autism spectrum, please do not pay a lot of attention to those temper tantrums. You have to be around, but you don't give in to those tantrums. And there are some behaviors which are reasonable, some behaviors which are unreasonable. So the unreasonable behaviors we definitely don't allow. Violence and aggression is not to be tolerated at any cost. So you may need intensive occupational therapy, you may need intensive physiotherapy, you may need behavioral analysis and accordingly finding out the root cause of that behavior. Sometimes the parental behavioral management and the behavioral management in school is not the same. So they need to be on the same page. But you do have a subset of children who are inherently aggressive. So they have neuronal excitability, and that's why they are aggressive. So there you may need to use a medical component as well. You may need little medication to control them. And this would even include children who show self-injurious behavior. So children who tend to bite themselves, pick their skin, scratch themselves, they particularly need medical help because we don't really have good behavioral interventions for that. And if they are showing impulsive aggression, what I say, it's unplanned, it just comes up and there's a huge rampage that happens, then in such children you need to have little medication because probably there is a chemical imbalance which is going up and down, which also needs to be then managed.
I think there was a lot of resourceful information. Um, so, Dr. D'Souza, the next question would be that what is the role of digital media for children and adolescents with ASD?
Well, I think digital media has a huge role when it comes to children with autism spectrum disorders for the very simple reason that one, there are many apps that can be used for children with autism spectrum. So you have apps for speech, you have apps for toilet training, you have apps for behavior, you have apps for language. So you can go and look at this whole plethora of apps and you will get an idea. Apart from that, there is also a large number of programs that keep the child engaged, which are academic. So again, digital media plays a role there. Children with the autism spectrum also love to play certain kinds of video games that improve their focus and concentration. While we would also say that yes, it doesn't mean that the child is for 6 or 8 hours on the gadget. So these are things which can be used and can be replicated, and that's how digital media is useful.
Okay. I think that gives a very clear understanding of how much exposure is required with respect to digital media. Dr. D'Souza, what would be the latest discoveries in the form of medication for ASD?
Okay. So like I mentioned before, we have oxytocin, which is one of the hormones which is being, used and experimented. We have secretin, a gastrointestinal hormone, which is also being tried. We have oxytocin agonists, which are drugs that work through oxytocin that are being tried. We also have drugs that work, newer drugs that work through the serotonin system, which are being tried. There are people that are looking at the use of testosterone antagonists, because we said extreme male brain theory is there. So that is also something which is being looked at. But all these are in a very experimental stage. And we also have stem cell therapy, which has come into India last 5 years. But to be very frank, we haven't seen improvement in children with stem cell therapy. It's an experimental therapy. The Indian Council of Medical Research, ICMR, very clearly says it's experimental. So if you may have agencies that give you a huge amount of promises with stem cell, please don't get lured by that. Read the scientific information yourself and take help from professionals who would be rational and judicious, and then take a call.
Absolutely. Okay. Um, so, Gayatri asked how to deal with hormonal issues in ASD adults.
Okay. So what she probably means is hormonal issues and the sexual issues that would ensue, with that. So what's very important to understand is that children with autism spectrum do have sexual feelings, and the reason for that is they have a body, they have the reproductive organs. They probably may not have the socio-cognitive emotional judgment on how to express those feelings, but they definitely have those feelings. And it's very important that when you see these changes happening, the child has to be told what to do, where, and when. So if he engages in self-stimulatory behavior or masturbatory behavior, he is not to be hit. He's not to be reprimanded. He is to be told that, okay, this can happen when you're alone in a bathroom. It cannot happen in the hall or the kitchen or in front of people or at a bus stop or in school. So sometimes the children may roam around the house undressed. So it's important that they are told that, yes, they can't do this. It's also very important that when a girl gets her period, she has to be taught how to use a pad, and how not to just remove her underwear anywhere if she's getting a period, and personal hygiene at the time of period, menstrual hygiene. And yes, there will always be a subset of children who don't understand this, so you will have to have a caregiver that has to do it or help them in doing it. So that's something which is very, very essential. The most important thing is, I think, in our minds we have to understand that children with the autism spectrum disorder are like any other human being. So they do get sexual feelings, and if they do get it, it's a part of normal development like any teenager would have. It's also prudent that we differentiate between sensory issues and sexual issues. So I remember that there was a child who was, who used to sit on a pillow or a sofa and do rocking movements, and the parents perceived it as sexual. And there was a child who used to rub himself against a wall, and the parents used to perceive this as sexual. And then we realized that with good vibratory and proprioceptive therapy through occupational therapy, the child did much better. So it was more of a sensory need, whereas the adults perceived it as being sexual. So sometimes we have to look at it from the child's perspective also.
Exactly. Uh, I think, Doctor, she was more so asking with this hormonal issues with respect to ASD adults.
Yes, so even in adults, I mean, these are the
It
same
would be the
sexual
same
issues
thing.
that
It would
actually
be
come up.
same.
Yes, the same sexual issues that come up. At this point, I mean, since we're talking about this very pertinent issue, which I think in innovations has come up, is a debate that is going on internationally. Should adults with autism spectrum disorders get married or not? And it's a very important debate which is going on, and the whole debate is that they don't have the social skills, they don't have the emotional skills, so how are they going to be a better parent, how are they going to be a good husband? So there's a lobby that says no, they shouldn't get married. There's a lobby that says no, they also are human beings, they also need a companion, they also need to have a family, and if they have normal to high IQ, why not? So why can't they get married? Why deprive them of that? As long as the partner is informed and aware of the challenges that she is going to face. So this is something which is there. So even adults, when they have sexual issues, I mean, I will, since we are in a very serious program where we have a very adult audience. I remember I had a parent of an adult with autism spectrum disorders who came to me and said that my child has no sexual outlet. So, do you think that if I, arrange a paid service and get him that sexual outlet, it would be useful? And I told him that the whole issue here is it's not about arranging the paid service. I said, what if he demands it every day? Because you have children with autism spectrum disorders that show repetitive behaviors, and then once they get used to a particular kind of stimulation, they may demand it daily. So I said, then what are you going to do? So I said, it's not unlike, say, I would say, any other person who probably may use this service once a month. I said, he may want it on a daily basis. What do you do? And I said, you rather teach him self stimulatory behavior whereby he finds some release for his own urges. So sometimes we have even gone to that extent to work with adults.
It's really eye-opening, and it's really informative for people to understand how to help individuals with certain this kind of requirements. Lovely. What is the role of various apps for ASD that we have mentioned earlier? I think you've covered it, but if you could shed some more light on it. Um,
See, I think there are different apps for different things. So you
okay,
have to first decide, what do I want to target. So if I'm looking for information, there are apps that give you information. If you're looking for language, there are apps that give you language. For speech, there is apps. For toilet training, there are apps. For
yes.
phonetics, there are apps. So you have to decide what you want and then go and
What?
search online and you'll find them. And these are not all apps which are specifically designed only for the autism spectrum. Even I think children from the mainstream schools could use them in their developmental years.
Right. Okay. Okay. Just want to see if there are other questions that we have. Okay, my voice needs to be loud. Maximum age of ASD in an adult, and is ASD curable?
Okay,
There
the
are two set of
question here is,
questions.
yes, the maximum age, I didn't follow what they meant by that.
I'll
If
reread
they,
the question. I'll
yes.
reread the question. Maximum age of ASD in adults. So I think the person is asking that at what age, maximum age that person can get ASD or it can be
Okay.
identified.
Now, usually always remember, autism spectrum disorder is a developmental disability. So it has to happen in the first 5, 6 years of life in the developmental period. So you cannot have anyone who's absolutely fine till the age of 20 and then one fine day you say, oh, he has autism. No, it can't happen. So then it could be a psychiatric problem, or it could be some head injury, something else which has probably caused changes. Secondly, what was the second question?
I'll reread the
Yeah,
question.
yeah.
Is it curable?
Okay,
ASD, is
autism
it curable?
spectrum disorders is controllable and it's manageable. You never really have a cure for autism. You can treat associated problems. So if he's aggressive, I can treat it. If he's socially aloof, I can treat that. If he is too emotional, I can treat that. If he is too excited, I can treat that. If he has ADHD, I can treat it. But autism as a core doesn't go. So you really don't have a cure for autism. You can just control associated behaviors.
Okay. I'm sure that answers your question, Nimbi. Is a regular school will a regular school will be able to manage ADHD children?
Well, if you ask me, ADHD children, definitely a regular school would be able to manage them. But if you're looking at ASD children, then it would vary child to child, because depending on his intelligence level, his needs, the therapeutic needs, the educational needs would have to be assessed. And then if the school has all those inclusive capacities, then we would be in a better position to, comment on whether the child can be accommodated. But ADHD, yes, I think if there is no other developmental disability and these are children with pure hyperactivity, definitely with medical help and therapeutic help, they could be managed in a mainstream school.
Any tips that you can share to deal with or with work with ASD? I think children only she meant she's written ASD. So I'm sure she means.
See, one of the things which you have to realize is to work with uh, autistic children. Your mind has to think autistic. It's very important. So it's like, to be a good detective, the mind has to think criminal. It's something like that. So similarly, when you work with autistic children, you have to think autistic. So you have to think from their perspective. So I always remember a mother came to my clinic with her child and said that he is refusing to eat chapatis and he doesn't like chapatis. So I said, have you ever asked him why he doesn't like chapati? So he said, chapati गोल है, मुझे गोल चीजें पसंद नहीं है, and that's the kind of rigidity they have. So I told the mother, you have two options, that either you cut the chapatis into squares and give him, and he'll have it. And he had it. So it was not his enmity against chapati as an entity. The enmity was more against the shape. So, or I said, give him bread if he doesn't want to have chapati, and he ate bread. So that was there. Similarly, we had another child who said chapatis are brown, and I don't like chapatis. So I said, put palak in it, put carrot in it, make it orange, make it pink, make it green, put beet in it. So the different colors enamored him and he ate. So sometimes, it depends. So the color of the food, the texture of the food. So you have to think from an autistic perspective. What is the child thinking? Similarly, I remember we had a huge furor once in one of the schools wherein an autistic child who was probably uh, 14 or 15 went and touched one of the teachers on the chest, and the teacher was very upset about it, and the parents were called. And I told the teacher, I said, I agree he's 14 or 15, but I'm very sure the intent wasn't to probably do anything in a very bad way. So I said, it's important that we ask the child, what made you do this? So I mean, the child was very blunt and said that I just felt teacher's chest was big, so I went and touched it. He didn't have any thought about sexuality there. He didn't have any thought about trying to say molest her or do anything out of the way, but the teacher was probably untrained when it came to handling children with the autism spectrum, so she took it otherwise. So sometimes you have to talk to an autistic child and try and find out from his perspective what is the thing. So I remember uh, in one of the parties, the parent took the child to a party, and there was one uncle sitting there, and the child went and hit the uncle on the back. So the uncle felt that he's getting violent and told the parents to take him home. And this child said, no, there was a fly on uncle's shirt, and I wanted to kill the fly. So small things enamor these children, and they try to go after that. So we have to always look at it from their perspective and try and find out, whether it's actually a behavior which is wrong, or is it curiosity, is it what is that. So that is something which is very important. And when you work with autistic children, always remember the focus has to be to make the child learn. So an educational system which will give more priority to obedience over curiosity will kill the autistic child. So that is something which you can't have.
That, that's that's really very well put across. I'm sure that will help people to understand how to differentiate. Um, Doctor, there's one more question. Are there any assessments related to ASD and ADHD?
Well, there are multiple scales available, multiple tests available. There are different centers that may use different batteries of tests as they wish. There is also an Indian scale for autism known as the ISA, which is what we use at Sion Hospital for giving the autism certification, which is the most trusted because it's Indianized and it's used as per our population. So that is what we prefer. For ADHD, we have a number of scales like the Corner scale. The Corner scale is a scale which is used by parents, teachers, and students. So the child also rates himself, the parent rates himself, and the teacher rates himself, because all these three entities play a vital role in diagnosing ADHD. So the scores are summed up and then ADHD is diagnosed. So we have different scales which can be used, and a different battery of tests. So including an IQ, which would be the basic requirement for any assessment. So this is all combined together.
Um, Rupali has asked, Doctor, that what are the thoughts on Qigong sensory treatment as a touch-based therapy for autism? QST is what she's talking about. As a
Okay.
touch-based therapy for autism.
Right. See, in all touch-based therapies, and Yukongs is not the only one, there are multiple other touch-based therapies that are used. There are two dimensions. One is scientific reliability isn't proven in rigorous studies. Touch in any form is useful because its sensitivity to touch is a hallmark of autism. So any form of touch therapy would help. So that's what we even do in occupational therapy, sensitize them to touch. So that's something which I think is very, very important. What's also vital to understand is there's also an ethical configuration here, that when you say touch therapy, I mean the physicality and physical boundaries should not be crossed. At the same time, it shouldn't happen that there's too much of physicality involved in therapy. So occupational therapists are very well trained in maintaining physical boundaries when they deal with children and adolescents, because it's very important. So I think any therapy, like some years back, there was something known as holding therapy, where it was said that the therapist and or the parent is supposed to hold the child very closely and tightly, so that affection and emotions are evoked in a child with autism. But it's no longer in vogue right now because of certain ethical issues, that it's something that wouldn't be promoted. So I feel any sensory therapy works. You got to try and test the model in your setting, and most importantly, make sure that the child's ethical boundaries aren't crossed and no form of ethical violation occurs.
Can you throw some light on nutrients for ASD?
Well, there has been a hypothesis that low vitamins are present in children with autism spectrum. So mega vitamin therapy, giving a huge amount of nutrients, work. So a lot of people earlier used to give a huge amount of B complex, a huge amount of other vitamins, nutrients, antioxidants in autism. But it's been now proven that this only seemed to increase the weight of the child and probably make him a little bit hungrier. And they don't really have any role as long as his diet is normal. It's only if his diet is poor, then you may have to supplement with nutrients. But otherwise, nutrients haven't really shown to have any uh, major positive role in children with autism spectrum.
Doctor, what is the role of a newer criteria in ASD?
Well, I think, see, earlier in DSM-4, which came out in 1994, and the DSM-4 revision, which came out in 2000, autism was grouped under the category of pervasive developmental disorders, and there were 4 disorders, rather 5 under that, which included autistic disorder or autism, Asperger's disorder, childhood disintegrative disorder, and Rett syndrome. And pervasive developmental disorder, not other specified. These were the 5 criteria, which were 5 disorders which were there. Now what has happened is they've unified this, and they've unified this to form what is referred to as autism spectrum disorders. So they mean everything lies on the same spectrum. And the reason this was done is because they believe that the treatment doesn't change, the methods of treatment and approach doesn't change, the medical treatments don't change, irrespective of diagnosis. The prognosis may vary a bit. So that's why you lie on a spectrum, from good prognosis to bad prognosis, from excess symptoms to less symptoms. So finally, they are all autism spectrum disorders. So now we no longer diagnose the individual disorders, but we prefer to diagnose everyone as autism spectrum. And that was what was introduced in DSM-5, which came out in 2013.
If any child has sensory issue, how does one reduce it?
Okay, if any child has sensory issue, you have to see what is the sensation that's worrying the child. Is it touch? Is it fine touch? Is it heat? Is it cold? Is it pressure? Is it proprioception? And accordingly, your occupational therapist will suggest ways and means to deal with it. Uh, Jean Ayers was an occupational therapist who came out with something known as sensory integration therapy, or SI, which has been used very often in children with autism, and that is what many occupational therapists are trained in. There are around 13 or 14 different variations of SI, which different people use, and different therapists have added to what Jean Ayers had suggested. So I think sensory integration is the way forward if you have a child with sensory issues. And you will have a therapist who will see you in his or her clinic probably twice a week or thrice a week, and would also give you home-based program for the child, which you have to follow as a parent at home regularly.
Okay. Um, Doctor, what is the role of technology and artificial intelligence in ASD?
See, I think the emerging role of technology and artificial intelligence is that we are now able to map the brains of children with autism spectrum. So there's something known as the Human Brain Connectome project, which maps connections between different areas of the brain. So it will map your brain, my brain. So huge number of normal population brains have been mapped. And we've also mapped a huge number of brains of children with the autism spectrum, or adolescents with the autism spectrum, or even adults. So now we know which brain areas in them are not connected compared to your brain and my brain. So that's how technology is done. And this is done through software which involves artificial intelligence, which is called neuronal networking software, that has computational models that does all this. Apart from this, artificial intelligence will also play a very important role, because you will also come to know it's a part of it is useful in robotics. You will also have walking, talking robots that will walk probably with the children. Children with the autism spectrum can be made to wear Oculus devices and feel that they are underwater. They can be made to wear Oculus devices and feel that they are in the sand, in the sea, in the mountains. In fact, one of the things which technology has done is, if autism children are very often affected when you take them to a new place, they find it very difficult to adjust to new surroundings. So one of the ways is you make them see that place that they're going to go tomorrow wearing an Oculus device. So they already have a perception and vision of it, that they've been there. So their behavior tomorrow when you take them there is far more subdued. So even technology can be used in that manner. And Google Maps also provides something called Google Doors. So when you click on a particular door, you can see what's inside that place, and you can even use that. So artificial intelligence is being used very well over there. And I think one of the things which also probably which will come in the future is this human connectome and human genome will be mapped for everyone, and then you'll probably know how your brain and genes function, and even get an idea of what disorders you'll probably get in this lifetime.
Oh, wow. That's something huge thing. So I'll just check. Yes, there's a question. How likely is a child to lie on an autistic spectrum if they have a significant sensory integration issues?
See, I think sensory integration difficulties alone is not the criteria for autism spectrum, because we have many children with sensory issues. The key issue is, do they have a speech problem? Do they have social isolation? Do they have reduced eye contact? Do they meet the DSM-5 criteria for autism spectrum disorders, which is available online? You can go and look it up. And if they do meet this criteria, then I think they fall more on the autism spectrum. Otherwise, I would just say that they have sensory issues and leave it at that.
Yeah. So I think she's asking that children with sensory integration and with autistic disorder, how often are they likely to lie?
I think quite often, if they have both together, definitely they're very often likely to lie. 95 to
Okay.
95.6%, I think, of times, yes.
Okay. Okay. Does play therapy have any role in autism?
Yes, play therapy does have some role, but the important facet in autism spectrum is to get the child to sit and play with you. Children with autism spectrum disorders prefer to have isolated play. So they prefer to be alone, they prefer to play alone, and they have different types of play. So they may have rough and tough tumbling kind of play, they may have destructive play, they may have constructive play. So it depends on what kind of play they like to do. So play therapy in a group setting doesn't work for them. Play therapy in an individual setting, again, they may just ignore the therapist and engage in what we call solitary play. So you have to see whether the child is receptive to playing and what kind of play does he like to do. So if you're able to sort of do that, then I think play therapy works. Otherwise, if you're not able to engage the child in the session, play therapy may have less role.
Does the color therapy help? And what are the best colors for autism?
Well, I think autistic children have their own color preferences. So you have to see what colors he likes. So I don't think there's any specific color that matters really. And color therapy, I think, they have preferences. Like I remember a child that was brought to me, and the mother said he wants to wear this green shirt only. He doesn't want to change it. What do we do? So I said, buy him 6 green shirts. So he has 6 shirts for the week. So sometimes you have to go with their rigidity and sameness. They do not like change in the environment. but so certain colors may be attractive to them, and they also may not like certain colors. So I always remember this very funny yet very scientifically very evident case wherein a child refused to go into his bedroom because the house was painted for Diwali, and he said my room was blue and I this is yellow, I don't like my, this is not my room. Though everything was the same, he said, no, no, this is not my room and I won't go. And it took them, literally over a month to get him slowly acclimatized to the fact that that's his room. And so one of the things which we did there was we kept certain blue things and then slowly changed it to yellow. We showed him on a video that blue and green becomes yellow. And, so some kind of, mesmerization was done to sort of help him understand that the room has now changed color and it's magic. And that's what has happened. And then he got used to it, because there was no way they could have repainted the room blue, so it was not possible.
Uh, Best therapy for ASD would be, doctor?
Which therapy?
Best therapy that can be used for ASD?
See, I think you have to see what works for the child. The best is a multidisciplinary team approach. So you need to have a doctor, a psychiatrist, or a pediatrician or a pediatric neurologist combined with a psychologist, combined with an occupational therapist, special educator, remedial help, a school shadow teacher may be needed at times, and a speech therapist. So all this work together as a team, and that's when you see the difference. So there's no really one therapy that works.
Um, uh, what messages do you have for parents with regard to parenting a child with ASD?
Okay. Now I'm saying this out of my experience of working for 2 decades with parents, and the first question that most parents have is, why the hell do I have a child with autism spectrum? And my parents were doctors. I'm a doctor. In my family we have 3 generations. No one has had any abnormality, and why is it that it's come to us? And I always tell them that it's happened. Now we can't do anything about it. Let's say you had a child who had asthma. Would you say the same thing? Let's say you had a child that developed a brain tumor. Would you say the same thing? Let's say you had a child that uh, developed, say, a tumor in the chest or the heart. Would you say the same thing? Now it's happened. What can you do about it? You can only work with it and rather help it improve. Let's say at least you're a doctor, you're scientifically aware, you will have the best help possible. You can do your best for your child. So look at it that way. And it's very important that one parents accept that the child has a problem. That's the first thing, and accept that okay, it's my child and the child has a problem. The second thing which I would want parents to do is get rid of the stigma associated with autistic children. So they very often refrain from taking the child out. They refrain from taking the child to a party, wedding, family gatherings, because they feel if the child does something wrong, they will then be embarrassed. It's okay to be embarrassed. It's perfectly fine. I remember uh, a child with autism spectrum, rather, he was a young adult who was 16, and he was attending his brother's marriage. And his brother was 24 or 25 and getting married to a girl. So he went and sat down at the wedding pyre and said, even I want to get married, and I won't get up from here till you get me married. And he started shouting and screaming. I mean, the Panditji was hassled, everyone was hassled. And luckily, I happened to attend the wedding because it was a doctor family that I knew, whose daughter was marrying the boy. So they told me, "Can you help?" So I had to request one of the ladies there that tell him, ki, yes, yes, we can't have 2 marriages together. We need to get you better clothes and better things. So only then you can get married. So I had to tell him, ki, you can't get married in a t-shirt and jeans. You need to wear a turban and you need to wear a kurta and you need to wear this, and we had to take him out from there at least for the timing, so that the marriage could be done away with. So that so these kind of things happen and there's no embarrassment. So I told them, please don't apologize to any of the guests. It's okay, let the marriage continue as though nothing happened. So that was one. Then there are instances where the child would soil his clothes with food, or drop water, or break a plate. I mean, parents have to realize it's normal and just say, okay, it's fine. I mean, we really can't do much. So it's something which people have to understand. Even air travel, I know parents who tell me that can you give some medication so the child is sleeping for 8 hours while we have a long flight. And I always say, I'll give you medication, but keep it as a last resort. Don't just sedate him and dope him and take him. Let him be on the plane. You explain to the air people that he has an issue, and if there's anything, we'll see. So I always remember it. It does work. I mean, you once you get confident yourself that I can manage the child, then I think that goes off. And the last thing which I will tell them is, please take care of your own mental health. If you ever feel low, if you ever feel depressed, if you ever feel upset, if you ever feel anxious, I mean, mental health help is available. Don't think, oh, I'm not mad to go to a psychiatrist, or I'm not mad to go to a psychologist. Please go and seek help.
Absolutely important point you made. Two things about accepting the child as well as taking care of your own mental health, which is of utmost important as much it is taking care of physical health that we do. Doctor, what are the kind of innovations for sex education among ASD? Um,
Okay, now we always felt it was a little difficult to do sex education with ASD children because they do not maintain eye contact. And how do you make them understand things? So we have used clay models of genitals, to explain to them how they are. We've had a group of children where we've used mannequins, which are used in the clothes shops, to explain to them body parts where they should not touch others, body parts where they should touch others, and even sort of make them understand that when you hug each other, you do not put too much of pressure on each other. Maintain physical distance. So these are things which are used, and we have a lot of videos which are used. In fact, I will use your platform to even disclose that I'm writing a book with some of my team members on sexual issues in developmental disabilities. And Alicia, who was on your show a few days back, is one of them. So she's writing that book with me. So the thing is that the whole book is focused only on handling sexual issues. And I think no book like that has been ever written so far, because the whole aim is to help parents. There's been a request by many parents that please write the book. And we're writing it in English, Hindi, Marathi. So it will be
oh,
accessible
that's
to
lovely. That's lovely. That's going to come as a very useful thing for everybody, especially with parents as well as for individuals who understand, who are working with ASD adults as well as children. So that's a wonderful initiative, Doctor. All the best for that too. I'll look for if we have another questions. Um, what sort of, I think, assessments we have already taken into consideration? Uh, how accurate are projective tests like HTP, DAP in identifying autistic tendencies in children?
Well, I think the role of projective test is limited, because the autistic child may not sometimes be able to project adequately. So it's very important that we may use it to assess psychological issues if the child is depressed or anxious or worried, but not for a diagnosis of ASD. No.
I think Dr. Bhakti has asked, no, sorry, Dr. Shobha has asked about causes of autism. I think we've already discussed. If we just give a brief about it, she joined us.
Well, there are multiple theories. Like I mentioned, there's a viral theory, there's been a vaccine theory, there's been a hormonal theory, there's been a gastrointestinal theory. So there are multiple theories which have been in vogue. There's an immune system theory, a neurochemical theory, but nothing has been proven so far.
Mhm. Okay. So yes, Doctor, any personal experience working with ASD children or adolescent which has been challenging, or are there any kind of limitations that you would like to share with the audience, especially the other mental health care practitioners, so that they can keep in mind while they work with them?
Okay, I will share two experiences. That one which
Sure.
I had in uh, Kalyandeep School in Villeparle, where I used to go, and I still go. Uh, I There was a child with autism spectrum who was very uncommunicative, and he had lost speech, and he would not communicate. He would not like to be touched. He would not like to be spoken to. So every time I would go, I would carry a small 5-star chocolate with me and give it to him. So initially, he wouldn't even accept it. So I would leave it and walk off, and the teacher would say after around half an hour, he would quietly come and take it and go. So after a few months, he began to take it when I gave it to him. So the most remarkable thing was that I was seeing another child and their parents, and this child and his parents were waiting for me. to see me next. So when they came to see me, this child removed an eclair from his pocket and put it on my table next to my pad. So the thing was, and he didn't say anything. So the mother said it's the first time in his life he must have given someone something. He's never done that. So I don't know what have you done to him. I said, no, I've been giving him a chocolate every time. So she said, so the bottom line is persistence. You can get, some communication out of the child. So that is one. The second is a very funny incident. It was my birthday, and I decided to celebrate it with the special children. So I wore a new suit and I went to the school, and I had a child with autism spectrum who came and said hi to me and just ripped off the pocket of my new suit. And there was nothing I could do about it but just smile. So in all my photos, I was wearing a suit without one pocket. But it's fine. I mean, these things happen. What I'm trying to say is, you will get your clothes torn, you will get, pushed, you will get shoved, you will get. These are all part of the game of managing these children. So we can't get upset or offended, or it's very fine. And if you have to work in this field, you got to be ready to take these small hits also.
Lovely. So, Dr. We have almost come to the end of the session. I'll see if we have any other questions. What advice would you give to a psychologist who's working with autistic child for the first time?
Get to know these children, work with them. The more you see these children, the more you learn about them. You won't learn about it from a book. I always say, मैंने जो कुछ भी सीखा है किसी कोचिंग क्लास या किताब से नहीं सीखा है, इन बच्चों के बीच में रह के सीखा है. So you have to learn being with them. You have to learn on the job.
On the job. Lovely. So, Doctor, we are almost at the end of the session, and it was really amazing having you, having so much of information, clarity with respect to ASD and anything related to it. And I'm sure our viewers also had all their queries answered. And yeah, it was an amazing session for me. Thank you so much for your valuable time and your inputs. And thank you everybody who's been watching us. Doctor, do you have anything to say at the last, if you want to share something before we sign
Well,
off?
I can only say that it's the first time I have been with you all. I mean, I look forward to, of course, being with you all again whenever I can. And most importantly, I think for
Sure.
anyone out there, any budding professional out there, if you need to know anything and you want to do anything about your career and you're confused, well, I'm the man. Just email me and I'll be more than happy to guide you.
That's excellent hand holding and mentorship offered. So yes, I'm going to sign off, and yeah, I'm going to see you all tomorrow again. So yeah, in fact, today was going to be the last session, but we've got an amazing response from our audience, and we're continuing the PsyTalks with psychologists for psychologists, and we'll be seeing you another few more days. And I'll see you tomorrow at 4. And tomorrow we're going to have a topic which is eclectic approach to therapy. And if at all you have any kind of query, you can visit our website www.ichas.com. ICH again, and sign off. Have a good evening. Thank you, Doctor, once again.
Thank you. Thank you.